Hey everyone, welcome back. I'm Dr. Christopher Daniel Dunch, and before we dive into today's topic, I need you to stick around for a few minutes. What I'm about to share could genuinely shift the course of your health, or the health of someone you care about, and I don't say that lightly. A few years ago, a patient came into my office, a 52-year-old father of 3. He was dealing with some persistent stomach issues, bloating, irregular bowel movements, and occasional fatigue. He didn't think it was serious. 6 weeks later, the report on my desk changed everything. Stage 3 colon cancer. The first question he asked wasn't about surgery, chemo, or radiation. He looked me straight in the eyes and said, "Doc, what did I do wrong and what can I do now?" That question has stayed with me ever since. The answer isn't simple, but it is actionable, more than most people realize. Today we're going to talk about colon cancer. Specifically, we're going to explore how certain foods, lifestyle choices, and biological processes can literally starve cancer cells, disrupt their growth, and, in documented cases, even halt progression, sometimes in advanced stages. Let me be very clear up front. This isn't about telling you that eating broccoli or turmeric alone will cure cancer. That's not what we're doing here. What we are doing is looking at the real science, peer-reviewed studies, that show how your everyday choices either feed cancer or fight it. And understanding that could literally save a life. First, let's talk about cancer cells. They're not invincible or mystical. In fact, they're very predictable. They thrive on sugar, they grow in inflamed environments, and they multiply when the immune system is overworked or compromised. Once you realize this, you stop being a passive observer. You start controlling the environment where cancer either survives or starves. Colon cancer in particular is one of the most diet-sensitive cancers we know. Think about it. Everything you eat passes through your colon. Every toxin, fiber, processed chemical, and anti-inflammatory compound touches this tissue. So it makes sense that your daily diet has a massive impact on colon health and cancer risk. Research confirms this. Up to 70% of colon cancer cases are linked to lifestyle factors, mainly diet. That's 7 out of 10 cases potentially preventable. That's staggering. Now let's get into what cancer cells eat. Colon cancer cells have a unique metabolic quirk. Unlike healthy cells, which can run on fat, protein, or glucose, cancer cells are heavily reliant on sugar. This phenomenon is known as the Warburg effect, named after Otto Warburg, who discovered it nearly 100 years ago. Cancer cells consume glucose at an astonishing rate, anywhere from 10 to 70 times more than normal cells. They're essentially sugar addicts. This is where your diet becomes powerful. Flooding your body chronically with sugar from processed foods, refined carbs, sugary drinks, and ultra-processed snacks provides a perfect fuel source for cancer cells. Patients often say, "I don't eat that much sugar." But when we log everything for 3 days, bread, pasta, fruit juice, granola bars, flavored yogurts, crackers, it's clear. Almost everything triggers a glucose spike. That spike feeds cancer cells directly. So the first step in starving colon cancer is simple. Lower your chronic glucose load. That doesn't mean eliminating carbs entirely, but it does mean choosing foods that maintain stable blood sugar. In practice, this might mean swapping white rice for quinoa or cauliflower rice, replacing your morning toast with eggs and avocado, choosing water or green tea over soda or juice. These small changes can dramatically alter the environment inside your colon. Next, let's talk about inflammation, another major fuel source for colon cancer. Chronic, low-grade inflammation acts like a pilot light in a gas-filled room. Over time, it damages DNA, disrupts the protective mucus lining in the colon, and creates a setting where abnormal cells can multiply undetected. What drives this inflammation? Processed vegetable oils, like soybean, corn, and canola oils, are major culprits. They're loaded with omega-6 fatty acids, which, when imbalanced against omega-3s, as in most Western diets, keep your body in a persistent inflammatory state. Red and processed meats also contribute. I'm not saying you can never enjoy a steak, but daily consumption of hot dogs, deli meats, or charred red meat exposes your colon to constant chemical stress. On the other hand, certain foods are powerfully anti-inflammatory and have been studied specifically for their effect on colon cancer. Turmeric, curcumin. Multiple studies show curcumin can inhibit colon cancer cell growth, trigger apoptosis, cancer cell self-destruction, and block blood vessel growth that tumors need to expand. Pair it with black pepper, piperine, to boost absorption by up to 2,000%. Cruciferous vegetables, broccoli, cauliflower, kale, Brussels sprouts. These contain sulforaphane, which activates NRF2, your body's master antioxidant regulator. Sulforaphane can selectively target cancer stem cells while leaving healthy cells untouched. Garlic. Crushing or chopping raw garlic and letting it sit for 10 minutes maximizes allicin production. Allicin supports detoxification in the colon and reduces cancer-promoting processes. Green tea. Its EGCG polyphenol inhibits tumor growth, reduces inflammation, and supports a healthy gut microbiome. Speaking of the gut microbiome, this might be the most overlooked factor in colon cancer prevention. Your colon hosts trillions of bacteria that actively communicate with your immune system and your colon cells. A healthy, diverse microbiome produces short-chain fatty acids like butyrate, which fuel colon cells and trigger self-destruction in damaged cells, while reducing inflammation. How do you support these bacteria? With whole food fiber, lentils, beans, oats, onions, leeks, asparagus, bananas, apples with skins. These are prebiotic foods that feed butyrate-producing bacteria. Harvard research shows that every 10 grams of extra fiber daily can reduce colorectal cancer risk by 10%. Now, let's tackle a tough topic: alcohol. It's classified as a Group 1 carcinogen by the International Agency for Research on Cancer. Even moderate drinking increases colorectal cancer risk. Alcohol damages DNA, depletes folate needed for repair, and disrupts the gut microbiome. Exercise is another crucial piece. Regular movement lowers insulin and IGF-1 levels, reduces systemic inflammation, and speeds up bowel transit, limiting exposure to carcinogens. Studies show that just 30 minutes of brisk walking, 5 days a week, can reduce colon cancer risk by 30–40%. For those concerned about advanced stages, including stage 4, there are documented cases of patients responding dramatically when metabolic strategies like low-carb or ketogenic diets are combined with conventional treatments. By reducing glucose, cancer cells are weakened, while healthy cells can adapt to ketones. This is not fringe science. It's actively studied at major oncology centers worldwide. Vitamin D is also key. Low vitamin D levels are strongly linked with higher colorectal cancer risk. It regulates cell growth and supports DNA repair. Aim for levels between 50–80 ng/ml. Sunlight helps, but supplementation is often needed, especially in winter or in regions with limited sun. Finally, let's talk screening. Colonoscopies save lives. Polyps can be found and removed before becoming cancerous. The American Cancer Society recommends starting at age 45, earlier if there's family history. If you haven't been screened, schedule it. It's inconvenient, yes, but life-saving. Here's the bottom line. Your colon communicates with you every day through your digestion, energy, and overall vitality. Every meal either builds an environment cancer loves or one where it cannot survive. The actions you can take right now: turmeric with black pepper, cruciferous vegetables, raw garlic, green tea, real food fiber, reduce sugar, processed oils and alcohol, consistent physical activity, monitor and optimize vitamin D. Get screened. These are simple, evidence-based steps anyone can implement. You don't need perfection, just consistency. If you're watching because you or a loved one is dealing with cancer, share this video and talk with your oncologist about how nutrition can support treatment. The research is there, and the conversation is worth having. I'm Dr. Christopher Daniel Dunch. If this video helped you, hit like, share it with someone who needs it, and subscribe. Each week we dive deep into the science of living stronger, healthier, and longer. Drop a comment below about what you want to see next. I read every single one. Take care of yourself.